Friday morning, the combination of COVID, the flu, and RSV inundating hospitals around the country with sick kids, including right here in San Antonio.
With such similar symptoms, it can be confusing to determine which illness your child may have. And joining us today is Dr. Norman Christopher, the Chief Medical Officer for the Children's Hospital of San Antonio. Good morning.
Good morning.
Hi, Dr. Christopher. What does our hospital situation look like here in the Alamo City?
Similarly, here in San Antonio, as throughout most of Texas and really throughout the country, there's significant pressure on all of our emergency departments right now with high volumes of sick children. The inpatient units are full, and we're planning on a daily basis with how to provide the best care and the highest quality care to all of these patients and families who are requesting treatment.
And we have heard specifically of hospital beds in some parts of the country filling up. Are we seeing that here?
All throughout Texas, we're at about 90% occupancy rate. We here at the Children's Hospital of San Antonio are meeting in a formal way at least 3 times a day to look at our bed capacity, volumes of patients in the emergency department, the number of patients who are being held, awaiting beds, both within our own emergency department, but as well as those who are in other community hospitals where patients are also presenting and requiring high levels of care. So all day long, every day, we're looking at ways to position our patients in the best possible way.
COVID, flu, RSV, any one of those would get a parent's attention. How can parents best determine which illness their child might have, Dr. Christopher?
That's a really important question, and it's not an easy. There's not an easy answer to that. I think some have heard of what's now being termed the triple-demic. RSV and influenza are very common viruses. They're very seasonal. We have been dealing with those 2 infections for many, many years during the fall and winter months. That was made more complex this year as children and families come out of isolation. Some of the preventive health measures that we were so compulsive about are not being used quite as compulsively anymore. And by that, I mean keeping oneself isolated when they're sick, using careful hand washing, masking, those sorts of things. So what we're being faced with right now is a rebound in these infections. In the last 2 months or so, we've had a fairly marked increase in the number of patients with RSV infection in our emergency department. In the last 2 or 3 weeks, influenza has made a very, very quick increase. The primary differences in those, RSV is an upper respiratory tract infection. The youngsters present with runny nose, cough, low-grade fever. As the disease progresses, they can have lung involvement, and so associated with that could be some wheezing and shortness of breath, rapid breathing. Influenza is a little bit of a different presentation. Influenza typically presents with muscle aches, fever, headache, and cough. We worry a little bit more in both of those cases in children who have underlying medical conditions, underlying health conditions, where the infection can be more dramatic and have a greater impact on the child's overall health.
And a lot of our kiddos are in school for a big chunk of a day, along with other kiddos. What can parents and caregivers do to keep their kids healthy?
Well, we encourage our families to have very close contact with their primary care physician, their pediatrician, or their family doctor if they're concerned about their child. We're discouraging families coming to emergency departments right now for more routine conditions. But certainly if a family is concerned about a medical condition such as what I've described, I think the best approach is to talk to your primary care physician first. Try to get the evaluation done in their office if that's at all possible, if that's feasible, and if not, of course, we'll take good care of those youngsters in the emergency department. I would recommend all of the same preventive health measures that we've done before. That is, if your child is sick, keep them home, use careful hand washing. People who are at high risk for more severe disease should be kept apart. And of course, there are vaccines available for COVID as well as for influenza. There is a vaccine under development for RSV. It's a Pfizer vaccine. It's not quite ready for prime time, but there is some promising results in some early studies.
All right, Dr. Norman Christopher, thank you so much for your time. We've covered a lot of ground. We know this is a very interesting topic right now with so many kids sick, but Dr. Christopher with Children's Hospital SA, thank you so much, sir.
Thank you very much.
Take care.
Keep up to date with all of San Antonio's top news, weather, and so much more by clicking the like and subscribe buttons below. And once again, thanks for watching KSAT.